Mtazamaji wetu tunatazama KTN News moja kwa moja, na kwa hivi sasa naarifiwa kwamba tutaelekea ikulu ya rais moja kwa moja hapa Nairobi, tuende tukasikie kauli yake. Kuna mambo kadhaa atazungumza, kanuni zile zilizoweka kulingana na COVID na baadhi ya mambo mengine.
15 months since we recorded our first COVID-19 case here in Kenya. And although our experience as a people have been different, the last 15 months have been a season of adapting to a new normal. Our former way of life was reset, and we all had to accept and adapt to a new and very unfamiliar routines. As you all know, to protect our children and to secure their future, we took them out of school. Similarly, we had to shy away from places of worship in order to preserve the believers, their families, their neighbors. And for the love of our elderly, we also had to forego visits to our elderly relatives in order to show them true love by caring for their lives. This has been the unfamiliar and uncomfortable new order for the last 15 months, not just here in Kenya, but globally. As a country, we have adapted to the new normal with grace and resilience, and for this I thank Kenyans. Terms that looked remote and far from our reach became our normal. The mention of curfew elicited anxiety and lockdown uncertainty. And over these 15 months, we have learned to anticipate COVID-related shock and to forestall its impact with speedy action. On our part, the government has provided swift policy actions and bold decisions whenever a COVID-related threat was detected. But our resilience as a nation against this pandemic is not just a governmental affair. The people of Kenya have also exercised a very admirable degree of civic responsibility in this fight. Indeed, Kenyans have taken the civic duty of protecting themselves, their families, and our country against this pandemic, and they have done so positively. Without your exercise of civic responsibility and duty, government's swift response would have amounted to nothing. And for this, I once again thank all my fellow Kenyans. For the last 15 months, COVID took us to a state of uncertainty in unfamiliar territory that was compounded by a series of dilemmas that pitted a choice between lives and livelihoods. But today I'm happy to note that a path out of this uncertainty is beginning to emerge, and the emerging path has two sides to it. The first is a challenge, and the second is an opportunity that has a promise. So let me begin with the path that is a challenge. For the last 15 months, our efforts of fighting this pandemic can only be described as containment seesaw. And I call it a seesaw because sometimes we win on one front and experience a loss on the other. For instance, the highest positivity rate this year was at 26.6% in the fourth week of March 2021. This forced us to zone out and lock down the COVID hotspots of Nairobi, Kajiado, Kiambu, Nakuru, and Machakos. These counties at the time accounted for 70% of all COVID-positive new cases. The lockdown brought the positivity rate down to 7.8% in May of this year. And as we ease the lockdown measures in the 5 zoned counties, the western region of our country and the neighboring Republic of Uganda experienced a new wave. Because of the unusual nature of this virus, our gains in Nairobi, Kajiado, Kiambu, Nakuru, and Machakos were nullified by the Western attack. Now Busia, Kakamega, Nyamira, Kisii, Migori, Siaya, Homa Bay, Kisumu, Trans Nzoia, Bungoma, Bomet, Vihiga, and Kericho are on heightened containment measures from the 17th of June of this year. In fact, out of every 5 positive cases in Kenya a fortnight ago, 2 were from the western region. And what is worse is that this region has experienced a high positivity rate of 21% compared to the national average of 9.1% at that time. This swing between loss and gain and the fight against the pandemic is what I'm calling the seesaw containment. You win in one theater of a battle and lose another. And by default, this swing has created some form of survival instinct in our population. The fight against COVID is both a social as well as a health challenge. And as such, we aspire for herd immunity in the health arena. And we seem to have built what psychological experts called herd instinct in the social arena. We seem to have built a national consensus on what we must do to defeat this pandemic, and I believe it is steadily working. Fellow Kenyans, the second path out of the COVID fog for Kenya is an opportunity with a promise. When we reported the first case of COVID-19 more than 15 months ago, the idea of a vaccine was nowhere in our minds. 1 year later, in March 2021, we were able to roll out a national vaccine deployment plan, and our strategy was to vaccinate 10 million adults by June of this year and approximately 16 million by June of 2023. But inspired by acceleration doctrine, which is about constantly increasing the speed of achieving our goal, we revised our vaccine plan, and instead of vaccinating 10 million adults by June of 2022, we expect that we will vaccinate the entire adult population of Kenya, which is 26 million people, by the end of this year. In fact, by Christmas of this year, we intend to have vaccinated over 10 million adults, according to our experts, and we will have built a capacity to vaccinate 150,000 people every day as of August of 2021. And this accelerated plan will be aided by a few swift, bold actions and programs. For instance, we have already ordered 10 million vaccines from Johnson & Johnson, with the first consignment arriving in Kenya in August of 2021. But in the process of negotiating with this company, we also have managed to get a lower price. For the price of 10 million vaccines, we will be able to have them deliver 13 million doses. And because the Johnson & Johnson vaccine is administered using a single shot, the speed of rolling out our vaccination program will therefore be accelerated. Using these vaccines and others in the pipeline, this is how we will vaccinate over 10 million Kenyans by Christmas of 2021 and 26 million Kenyans by the end of 2022. And if a vaccine for underage populations is registered by early next year, we intend to vaccinate an extra 4 million young adults by June of 2022. With a vaccinated population of 30 million people, this will allow us to begin the journey for herd immunity against this pandemic, and this is our intention for the next 12 months. In that regard, and following consultations with the Council of Governors, and also with the advice of the National Emergency Response Committee to COVID-19 and the National Security Council, today again I issue Public Order number 4 of 2021. And that is, number 1, that the hours of curfew are maintained at between 7 p.m. and 4 a.m. in the COVID-19 hotspots, which comprise the counties of Kisumu, Siaya, Homa Bay, Migori, Busia, Kakamega, Vihiga, Bungoma, Kisii, Nyamira, Kericho, Bomet, and Trans Nzoia up to the 31st of July 2021. That for the rest of the territory of the Republic of Kenya, the nationwide curfew shall continue to be observed from 10 p.m. to 4 a.m. for a further containment period of 60 days. That excluding the above-mentioned counties, in-person worship and congregational worship shall continue to be conducted in keeping with the one-third capacity rule and in accordance with the guidelines of the Interfaith Council. That the prohibition against public gatherings is extended for a further 60 days. That all persons coming into the country must be in possession of a negative COVID-19 PCR certificate acquired no more than 96 hours prior to arrival into the country, with a PCR certificate also having been validated by the trusted travel platform for those traveling by air. That duly classified and licensed hospitality establishments must continue to adhere to the guidelines issued by the Ministry of Health. The establishments must also ensure the adoption of and compliance with the tourism safe travels protocols developed by the hospitality sector themselves. In regards to funerals, cremations, and other interment ceremonies, it is directed that these ceremonies shall be conducted strictly within the 96 hours of confirmation of death. That the attendees, officiators, and facilitators of funerals or graveside cremation ceremonies shall be limited to 100 persons in total. That the attendees, officiators, and facilitators of wedding celebrations, of marriage or traditional union ceremonies or rites of passage, and all other similar events or ceremonies shall be limited to 100 persons in total. That all hospitals are directed to limit the number of visitors for hospitalized patients to 1 visitor per patient per day, and that all other rules, guidelines, and protocols not reviewed through this public order shall continue to apply until otherwise notified. Fellow Kenyans, let me conclude with just 2 thoughts. First, it is now clear that we cannot exclusively depend on foreign partners and their systems to resolve our health crisis. And in that regard, we must substantially prepare ourselves for the next crisis before it knocks on our doors. As a government, we are addressing this matter through a medium-term and a long-term strategy. In the medium term, we will be building in Kenya a fill and finish plant, the plan being to import the COVID-19 vaccine unpackaged and finalize the logistics of filling and packaging here in Kenya. This will save us on time and will make us a supply hub for the East and Central African region. Our long-term strategy is to set up a human vaccine center, and as to this regard, I have directed a multi-agency team to activate this plan and to focus not only on the COVID-19 vaccine, but on any other human vaccines that are needed in our country and in our region. The national quest to produce human vaccines here in Kenya will elevate our nation as a producer for both human and veterinary vaccines that we currently supply to Eastern Africa all the way to Morocco in North Africa. The second thought is about the uptake of the COVID vaccine. Once we begin the mass rollout in July this year, unfortunately, some Kenyans have formed certain theories about vaccination and its effects. Although vaccination is free of charge and no one will be forced to get it, some education about it is critical. And I say so because by mid-2022, we have potential to reach herd immunity in which the danger of one infected Kenyan will not affect a community of people unchecked. But we can also build herd instinct in our communities. If herd immunity is meant to respond to an attack, herd instinct is meant to anticipate the attack and to stop it. And this can only be achieved through vaccination and vaccine education. To this end, we urge the Interfaith Council, working with the private sector partners and other civic associations, to take up the vaccine education and for it to be a central plank of the upcoming vaccination drive. This way, we will build a herd immunity and ensure that the instinct of communities to survive remains high. I thank you for your attention, and let me just continue to urge all Kenyans to do everything they can, not only to keep themselves safe, but also to keep their brothers and sisters, their parents, also safe. We can see what is happening across the globe, on our own continent. We are glad and happy that the measures that we have taken have helped us contain this disease as much as possible. But that can only and will only continue to be a successful route if we as Kenyans continue to work and collaborate together and support each other in this endeavor until we have truly defeated this pandemic and ensure that all of us are able to see the end of the rainbow. With those few remarks, I say thank you very much. God bless you all. Asanteni sana. Thank you.
Okay. Ni hotuba ya Rais Uhuru Kenyatta kutoka ikulu hapa jijini Nairobi, akiwa ameangazia mambo mawili ya msingi zaidi: kanuni zile mpya za Covid-19, pamoja ameangazia zaidi pia janga lile kuhusiana na chanjo za corona. Na amesema kwamba ile kafyu iliyowekwa na zile kanuni kutoka maeneo ya Nairobi, Kajiado, Kiambu, Machakos ilisaidia sana kupunguza maambukizi kutoka 26.6 mwezi Machi hadi 7.8, na hivyo mkurupuko tena ule ukashuhudiwa katika maeneo ya maziwa makuu magharibi kule mpakani mwa Uganda. Rais Uhuru Kenyatta akisema sehemu zile za Kakamega, Nyamira, Kisumu, Migori, Bungoma, Vihiga, Kericho pamoja na Homa Bay na Kisii wataendelea na zile kanuni zilizokuwa zimewekwa katika kipindi cha siku 30 zilizopita. Hivyo wataendelea kwamba kafyu yao itaanza kuanzia mwendo wa saa 1 usiku hadi saa 10 alfajiri katika siku zingine 60 zinazokuja. Na maeneo mengine hapa nchini Kenya wataendelea kufuata zile taratibu, yani kafyu kutoka mwendo ule wa saa 4 usiku hadi saa 10 alfajiri. Ameangazia zaidi katika swala la chanjo, akisema kwamba Kenya inalenga kufikia wakati wa Christmas mwaka 2021 kwamba watu milioni 10 wawe wamepokea zile chanjo. Alafu vile vile anasema wanalenga kufikia mwezi Agosti mwaka huu kwa siku moja iwe Wakenya 150,000 wamepokea chanjo ya Covid-19. Na hivyo akisema kufikia mwaka 2022 basi tutakuwa tumefika angalau Wakenya milioni 26 wamepokea chanjo zile za corona. Na tutakapofika Wakenya milioni 30 basi itakuwa tunaanza kujiondoa katika hatari ya janga hili. Baadhi ya maagizo mengine ambayo wameyatoa ni kwamba tena ile kafyu kama nilivyokuarifu kuanzia mwendo wa saa 4 hadi saa 10 alfajiri, saa 4 usiku hadi 10 alfajiri itaendelea kwa siku nyingine 60 hapa nchini Kenya. Kwa hivyo wale wanaotaka, waliokuwa wanapanga kwenda kukesha tena katika sehemu za bustani za kujivinjari, itakuwa bado kazi ile kwa kulingana na haya aliyotoa Rais Uhuru Kenyatta. Maagizo ni hali yataendelea. Alafu vile vile sehemu za maabada, nikimaanisha misikiti, makanisani, bado tutaendelea kuzingatia ile thuluthi moja tu ya watu kwenda kuabudu kwa ajili ya kuzuia pia virusi kutoenea. Amesema katika maeneo yale ya sehemu zile za mazishi, harusi, lazima kutakuwa na utaratibu ule uliotolewa na Wizara ya Afya, bado uendelewe kufuatiliwa. Alafu mikusanyiko ya umma kama maeneo, nikimaanisha masuala haya, mikutano ya kisiasa, kampeni, michezo, amesema pia ni marufuku na itaendelea kwa siku zingine 60. Kwa hivyo wanasiasa wale walikuwa wanataka kuingia katika makampeni, marufuku inaendelea, na hivyo ni kwa ajili ya kuzuia maambukizi. Wageni wanaokuja hapa nchini Kenya kutoka ugenini pia wameambiwa watatakiwa kuwa na zile vyeti ama kadi za kuonyesha wamepokea chanjo. Rais